So there's a lot of transmission here at sports. We've seen transmission at fitness centers and gyms. There's lots of reports in the literature of super spreader events at group classes. And so we wanted to get back to that, but we didn't want a repeat of November and December. So the other option is, let's try to get back to those group classes. Let's try to get people more active, but we have to find a way to have further protection. And so that option there, which arises, is masks. So certainly it's, when people are active, some report that it's, quite challenging. But we saw what happened in November and December. So if we wanted to get back to those things now, we have to do something to further mitigate the risks. And at that time, right now, that's masks. So again, none of this is forever. We have a vaccine rollout, we have spring coming, but right now, to be able to get back to those activities, we couldn't achieve the same risk level that we had in November and December, or we'll see those numbers again.
From CHVN, Taylor.
Hi, good afternoon. We're seeing those case numbers drop, but at the same time, a lot of crowding in malls, people not wearing masks in public places. How do we balance the confidence of these lower case numbers with still being safe with COVID? Why would someone still keep following these fundamentals?
Yeah, I think this is the point here where we're at a really important stage in our battle here on the pandemic. We have numbers coming down. So our, the numbers that we saw, that we came accustomed to in November and December, certainly we are much improved. We have vaccines starting to roll out. We have spring coming. So it's really important for us to articulate that we are not in a risk-free zone right here. We need to keep these numbers down, need to keep that test positivity down so we can have these mass vaccination clinics. So public health can work on vaccine, and so this is what we're talking about with the masks and some people seeing that as an imposition. Especially in sports or physical activity, our risk isn't gone. We want to get back to those things, but we have to be very wary of transmission again, and those are the type of things that led to a lot of transmission in the peak of the second wave. So let's get back to a lot of things we love, but let's do so in a reduced risk manner. And again, this is not forever. We have a lot of things to be optimistic about, but we've got to keep these numbers down so we can get those vaccines out.
And a year ago this week was our first presumptive COVID case. How have you seen attitudes and perceptions about the pandemic change from a year ago to today?
Well, I think it's tough to sort of sum that up. I think it's been the pre-pandemic stage seems like a different lifetime ago to me and to other people. And I think that early on we went from a hearing of a virus that we weren't yet sure its pandemic potential, to one that quickly made its way around the world, to quickly cause a lot of morbidity and mortality. And we saw the shift to the risk of international travel, followed up to risks of other transmission within the community. We've seen where our numbers have significantly dropped our last summer, where we had a fairly nice spring and summer, only to be hit with a very hard second wave. And then now we're back to where we were in the spring and summer, where we start seeing numbers trend down. And so we have to be really cognizant that we can't see that repeat of that of what we had in November and December. We have to stay cognizant of that. We have to be able to get these vaccines rolled out, and it's very challenging to do that if we had our 10 or 14% positivity that we were seeing earlier on. So I think things are, there's absolutely reason to be optimistic right now, but that doesn't mean we can let our guard down.
Thank you.
From the Winnipeg Free Press, Danielle.
Hey, Dr. Roussin. Can you please clarify when the province first started screening for B1351 and just that NML was always sequencing for that variant? And why wasn't this program in place at the same time that screening was introduced for B117?
Right. So B117 was early on in February. I don't have the exact date on that, and then we started screening for B1351. Near the latter part of February, and it just takes time to develop these tests. So the sequencing, you're right, had always been taking place. So we'd always be sending those select samples plus a random sample to NML for sequencing. But we're able to ramp up our ability to now screen through a PCR a PCR way. But yeah, it just takes time to develop, to validate these things. And so the UK, the B117 was developed first, followed by the variant of concern first identified in South Africa.
Okay, thank you very much. And I was wondering if you could speak at all about any trends that public health has noticed in southern Manitoba when it comes to transmission in public places, since the restrictions were eased in late January.
Yeah, so I don't think we have any specific things to report. I think that in all regions we're seeing the trend downwards. Certainly the northern health region is most notably affected right now, but in the other regions we're seeing that continued downtrend, and where we see transmission. Still, for the most part, right now with these lower numbers, we're seeing a lot of transmission within household contacts. Although we see transmission in pretty much any setting where we see indoor prolonged contact. So I don't have anything specific of note of the Southern Health though.
From Global News, Brittany.
Good afternoon, Dr. Roussin. Brittany from Global News. We've heard from a lot of people who are frustrated when you look at other provinces that have higher caseloads and have, I guess you could call it, more freedoms, or there's more openings, whether it be restaurants or other areas of small businesses. And we've heard from you a lot that we need to learn to live with the virus. But some say locking down isn't living with it. What is your definition of learning to live with the virus?
Well, I think the fundamentals are certainly the way we articulate living with the virus, and we absolutely did try that, right? Like in September and October and into November, we went with the messaging and tried to limit things that way. We didn't get a limitation on the transmission of the virus, so it wasn't until we had some significant restrictions that we did see those numbers start to trend down. And so that's, we certainly want to do whatever we can with the least restrictive means. And I think if you look at other provinces, I think there's variability, right? I mean, there's some provinces that in certain areas have just lifted a stay-at-home order. Some provinces have had curfews. And so, there's been times where we've been less restrictive than other provinces. There's been times in certain scenarios where we're more restrictive. So each area needs to pay a particular attention to their epidemiology and their risk. And I think that we're on the trend to be loosening. And I think right from the outset of this latest round of loosening, we've said from the beginning, we're going to do it cautiously. We're going to do whatever we can to not have to go backwards. And so far, it's we're holding true to that.
Thank you. And we saw the approval of AstraZeneca, and we heard from Dr. Reimer last week that we were going to be looking at prioritizing people within that 50 to 64 age range to begin with. Do you know when that list of what those priorities are going to be is going to be released, and when people can start looking for that and whether or not that's going to apply to them?
Yeah, I don't know the necessary details. I've been part of those discussions, and I think it's it's the appropriate plan to have that age target, but then within those age targets, the highest of the higher risk comorbidities. And so I think there's been a lot of work with our medical experts on devising that list. And then there's been engagement with the people who are going to be distributing this vaccine, so primary care providers, pharmacists. So I don't know when that list is necessarily going to be released to the public or exact mechanism for it, but there's been a lot of work to ensure that when it does, we're expecting a good uptake at that AstraZeneca vaccine. I think it's a great addition to our repertoire here.
From the Brandon Sun, Michelle.
Good afternoon, Dr. Roussin. On Friday, Dr. Atwal cited outbreaks at funerals and weddings in Manitoba, Canada, and internationally as the reasoning to severely restrict the number of attendees at funeral services in Manitoba. However, funeral director David Clausen clearly stated for a story I wrote that such outbreaks usually occur at funerals where a funeral director was not engaged. In its deliberations, has public health differentiated between family or group-organized events versus funerals regulated by a funeral director? And along the same lines, why are weddings and funerals conjoined in public health orders?
Yeah, and so, these type of gatherings are, gatherings where the fundamentals are difficult to maintain. To be part of a grieving grieving family and staying 2 meters away from everyone, and so we see that we see it in our jurisdiction, we see it in jurisdictions around the world. So we know how important these are. We know that just like in any sector, there are individuals and there are certain areas that have done amazing work to try to reduce the risk. But despite that, we still see a lot of transmission. Look at our bulletin today, where we probably have about 40 contacts from a similar exposure. So, I think to every to every sector, but certainly to funerals, people grieving, where this is challenging enough as it is. It's going to be challenging enough during a pandemic, and now add to that, you have to follow these restrictions. But they are there to protect the health of the public, as we see a lot of transmission. Why they're grouped with weddings and funerals is, obviously the nature of the event is much different, but the public health risk is much the same, both in the character of it and from the literature. So, we know it's important, and this gentleman that you're speaking to, I'm quite sure has put a lot of work into doing what they can to make things safe. Despite that, and at no fault of their own, we see a lot of transmission in these events, so we have to protect the health of the public.
Okay, thank you. And further to that, the president of the Manitoba Funeral Service Association, Kevin Sword, poses this dilemma. He said that many of the association's members have reported hearing feedback from some of their families who say that since these rules are too restrictive and we cannot have our immediate family and close friends at a funeral home or church, we will do something privately on our own. When the public perceives a rule as unfair, there seems to be a far greater potential for them to carry out some form of gathering on their own in the privacy of their own residence. This is counterproductive to public health goals, as there is no contact tracing, there are no safety protocols in place, and there's no oversight by professionally trained funeral staff. Wouldn't allowing slightly larger gatherings with the proviso that they be held with licensed funeral directors help mitigate this issue?
Well, I mean, that's certainly a thought. I don't know if we have any evidence to suggest that is the actual case. We can see from our numbers that these restrictions have been effective. And like we say, is that those type of speculation is not unique to this set of the orders, right? Any order that we have that the public doesn't follow won't be effective. So that kind of just goes without saying. That's we do take things into consideration with that. That's why we, as soon as we can lift restrictions, we do loosen them, because we know we need public buy-in. And our numbers suggest that for the most part the public is buying in. If we look at our, the surveys that we hold, we can see, a large amount of buy-in from the public. So again, I think that, there's, the work that's been done with these directors and these two gentlemen that you mentioned here, I'm sure is outstanding. And I think that this isn't going to be forever, and we're going to be able to continue to loosen things. But we just see that there's transmission at these events, and it's not just in our jurisdiction, it's in jurisdictions around the world. And it shouldn't come as a surprise because we know this virus is transmitted through prolonged, close indoor contact. And so it's any setting like that increases risk of transmission. So we're going to continue to loosen things in a cautious manner. And and I really hope to be able to loosen things in those sectors too along the way.
From CJOB, Will.
Hi, good afternoon, Doctor. The CDC just released its recommendations for fully vaccinated people. I'm wondering how close are we to having similar recommendations here now that Manitoba is on track to have a wider swath of the population fully vaccinated?
So this is something that we're looking at right now on what is our approach for fully vaccinated individuals. Do they still get named contacts? Do they have to self-isolate? So we're working on that. You're right. Early on, where we have such a small proportion of our province vaccinated, we didn't really want to make big. Efforts into how we're going to treat vaccinated people different because they're making up such a small proportion of the province. As we get more and more people vaccinated, we're going to be able to address some of that. There's still some uncertainty, around the vaccine. From what we see is that all of the approved vaccines do a great job of protecting against symptomatic disease. They even do a better job against protecting against severe disease, and so this is vital. We don't know yet how great they do about preventing the transmission of the virus. So we're still going to be cautious on our approach on those public health messaging. So right now, whether people are vaccinated or not, we want them to follow those fundamentals, to follow all public health advice. As we learn more and more, as a greater proportion of Manitobans are vaccinated, then we're going to be able to move even further on that.
Okay, thank you. And I'd like to go back to the retroactive screening for virus variants. I'm wondering, when do you expect that screening is going to catch up to real time? And I believe you touched a bit on this earlier, but what exactly is the benefit of screening tests that are now, over a month old?
Yeah, it's more so. I don't know the exact time frame, on that. I think that there's a lot of work going done. So I don't want to give a specific number because it's the lab is doing tremendous work. But how quickly they can go back and screen all positive samples, I can't give that number. The benefit is to understand the impact on our population. So we found 3 of the confirmed cases so far of the B1351, and so we want to go back to February to ensure we don't see a greater amount of transmission than what we're seeing right now. From what we have on board, it doesn't appear to be a significant amount of transmission, but we wanted to be certain.
Okay, thank you.
From the Winnipeg Sun, Glenn.
Yes, Glenn Dawkins from the Winnipeg Sun. Is the province considering fully reopening schools, or is the continuation of the alternate day attendance? Do you have a sense on where the province is planning to go with that?
No, I don't have a specific answer I can provide you on that, other than our usual approach is that we're always looking at the public health restrictions and and public health advice in all these settings. So I think as numbers go down, as vaccines go up, that's definitely things that we can consider. But we don't have anything specific on that right now.
Looking over the last couple of days of the positivity rates, you said the hospitalization rates have been better, the number of active cases has been better. It seems slightly that they're since Friday they've been going up slightly. Is that of any cause of concern with Friday being the latest reopening plan?
It would be too soon to have any of these cases or hospitalizations related to the newest round of openings. I think we still have overall that trend has been coming down. Obviously, we have to watch all of our important indicators as we move forward, especially as we're trying to reopen things. And so that the test positivity rates, the hospitalization rates, so we're continue to watch them, but it's too early to make a conclusion about that.
From CBC Radio Canada, Matthew.
Hi, Dr. Roussin. With 4 types of vaccine in Canada, is the province agreement with Providence still a good thing for Manitobans?
Sorry, I didn't quite catch that one. Can you repeat that?
With 4 types of vaccine in Canada, is the province agreement with Providence still a good thing for Manitobans?
I don't know if I have anything specific to add on that. I think that we want to do whatever we can to ensure Manitobans can be vaccinated. So I think any option we have, and remember, we've already seen instances where our vaccine supply chain has been disrupted, in the short term, and so there's a lot of optimism. There's a lot of optimism with the amount of vaccines that are coming out, but unless until they're actually here in our freezer, we can't count them. And so I think having as many options available as possible is can't be a bad thing.
And it's possible to get an update on the outbreak at the St. Boniface Hospital?
I don't think I have anything specific on that. We can try to get something out to you on that.
From CBC Manitoba, Bart.
Hi, Dr. Roussin. You guys rarely release info on possible exposures anymore. You say there were 40 contacts exposed at this church. What happened there? Tell us a little bit more about that.
Yeah, I don't really have anything to share specifically on that. We, like per usual and all the way around, we've announced when there is a risk to the public. So in this certain circumstance, we're able to identify a number of the close contacts, but we weren't able to identify and contact all of them. And so being a higher risk setting, we decided to make a public disclosure so all those people would be aware.
We continue to see a disproportionate number of cases in Northern Health, given its population. Aside from Puckedawagan, Matthias Colomb Health District, what are the health districts where the new cases continue to be popping up?
Well, there's a number of First Nation communities that still see a number of cases. So for the details on First Nations cases, I'll direct you to FNIB or the other stakeholders there. We still see a number of cases within Thompson daily as well. And so there's been some clusters in that area. So I think that we see it the transmission in a number of communities. You mentioned one that's currently in a growing number of cases, but we also see Thompson being affected as well.
Our final reporter this afternoon from the Canadian Press, Steve.
Oh, hi, Dr. Roussin. I know you don't tend to give out too much information, but to follow up on Bart's question, I think there's a tremendous public interest in learning about this possible exposure last Thursday. You mentioned some 40 contacts. Was it some event that contravened public health orders? Was it 40 people in a room, or are those secondary contacts? Was it a funeral, a wedding, a religious service of some sort?
Yeah, well, I think it's. I think in the in our bulletin, that's probably as much details as we have. I believe this was a funeral that occurred. I don't have the details about what time frame that took place over, so I don't have details on whether anything was contravened or not.
Okay, and I think you were asked about this Friday, but I'm going to give it another go. There's an attempt being made to check whether healthcare workers might have jumped the vaccine queue. That was released to us publicly on Friday. Are you in a position to tell us whether this has in fact happened? What has prompted this attempt to verify whether people have been jumping the vaccine queue and get vaccines ahead of when they should be?
So I don't know whether it's happened or not. I think what brought it forward was there had been a number of complaints received from individuals, reporting that individuals had jumped the queue. And when we looked back and through a number of the privacy legislation, we weren't able to actually investigate that. So we don't know whether anyone has done it, and but this actually enables us to investigate when we get those complaints.
Thanks, everyone. This concludes our media briefing.
Thanks, everyone.